part of our program.
Thank you so much, Dr. Calloway, Jerry. If we could go back to the agenda, I wanted to just walk people through what tonight is going to be. We're so excited to have Dr. Fayola Edwards-Ojeba, a real expert in this subject of systems changes. So we will start with a wellness exercise by Dr. Gail Wright. We'll go straight into Dr. Fayola Edwards-Ojeba's presentation on burnout. Then we'll break up into 2 breakout sessions. Hope to get some great participation there. We will debrief about these breakout sessions, come up with individual solutions, and then we will end with a wellness bite and some reminders at the end. So I want to just start by introducing Dr. Gail Wright before we go into her wellness exercise. I have the great pleasure of working with her here at Santa Clara Valley Medical Center. She's a pediatric critical care physician and pediatric cardiologist. It's a mouthful. Dr. Wright also is a consultant for individuals, teams, and organizations for clinician professional development, resilience boosting, and wellness. And you can find out more about her offerings and reach her at redwoodresilience.com. She will also be hosting a spring renewal retreat just in about 2 weeks at the coast on March 26, 2022, along with Dr. Jesse Mahoney from the SF Marin Medical Association. The SCCMA. We have a volunteer there for the retreat. The SCCMA encourages physicians to recharge. And so we're actually going to go ahead and support 4 lucky members to attend this retreat for free. There's a raffle you can find on our wellness page, our physician wellness page at our organization's main website in order to fill out a survey and potentially win this amazing retreat. I'll be there. I'm so excited. In addition, Dr. Wright will be offering 4 reflection rounds during April for SCCMA. Reflection rounds provide an opportunity to gather as colleagues to reflect on and explore how encounters in medicine affect us personally. And again, find out more about this on our website. Go on. Now we can definitely jump into our wellness exercise with Gail.
Well, good evening, everyone. You probably, like I just came zipping out of clinic on the way to get set up for this, got 2 phone calls about patients, and here we are, right? So if you think I've just been relaxing all afternoon, I've been right in it with you guys. So let's take just a moment to put down whatever we're holding on to. Settling in together, allowing ourselves for a moment to just be here. Pausing. Connecting to our own bodies and to each other. Noticing the tidal rhythm of the breath. How easily the breath comes and goes without us having to call it up or try to control it. Breathing in that which nourishes us and sustains us. Breathing out that which is no longer needed. Noticing the ease with which we breathe out and let go of what no longer serves us. And the courage and openness of taking in what is fresh and new. Rhythmic renewal of our internal landscape, just as the spring buds begin to emerge from what had died and decayed in the winter earth to become visible blossoms. The breath naturally recharging us, moment by moment, allowing us to return to serve the outer world. Gathering. And our children recharge us too, and their sweet little voices remind us of the cycles of our life's journey as well. Now guiding our attention back to this present gathering of healers, we welcome Dr. Edwards-Ojeba.
Thank you very much. It's my privilege to introduce Dr. Fayola Edwards-Ojeba. She had her undergrad at Harvard, where she graduated with honors, not surprisingly, medical school at Yale, and internal medicine residency at the University of California in San Francisco, where she's been a teacher and caretaker for patients. So she's definitely grounded in the real world that we work in every day. She's had her own experiences with burnout and emerged from that, creating Recharged MD. It's professional coaching and addresses system issues. She has an expert team that works with her. She is the founder and CEO. So it's with a great deal of pleasure to turn the program over to you. She has a smile that lights up a room.
Thank you so much for that introduction and the ability to be here with you all today. And Dr. Wright for that intro. I always have the jitters before talk, so it's helpful to center me as well. So I appreciate that. I'm just gonna pull up some slides here. And we can get started. And as we mentioned before, we want this to be an opportunity for you all to connect with each other about your kind of experiences within your organization around burnout and how it's impacted your practice, as well as just have the opportunity to connect with each other. I think we're all kind of yearning for that in some sense. And so we're hoping to be able to facilitate that this evening. So you heard a little bit about me, but just sharing in some more detail. Yeah, I got involved in this burnout work just given my own personal experience and was not the path that I was planning to take within medicine. And back in 2018, really had a challenging time. I was pregnant with my second child, and I just thought I wasn't cut out for medicine, and thought that, you know, the only option was to leave the field altogether. And it was in going through that process that, you know, I realized medicine is a small community. I might as well, you know, share what my story is so that hopefully, oops, can everyone check that they're on mute, please? Okay. Yeah, so in the process of kind of just sharing that with others, it was able to see how common it is. And the fact that we don't talk to each other about it and that there's still a lot of stigma. I think for me, that's kind of what got me started in this journey. And how do we create more spaces like this where we can connect about our common experiences. And then aside from that, just looking at the numbers, seeing how prevalent it is, realizing that there have to be upstream causes of burnout that is now kind of widely accepted. And what can we do to address it so we're not just putting it on ourselves as individuals to be able to heal. And so that's pretty much what's got me kind of involved in this work. And so you heard about the agenda, so I won't go through it again, but would love to hear from you in the chat, kind of what made you sign up for this talk today and what motivates you to be involved in wellness advocacy. Because it can be challenging work, right? You want to make an impact, but sometimes there's not always the organizational support behind it or the budget or, you know, having a team to help you. And so it can definitely be a challenge. So if you care to share, you can put a few comments in the chat. If not, then we can definitely kind of address it within our breakout sessions. All right. So I'm gonna move on. Okay, so not going to belabor the point because I think we all know at this setting kind of what burnout entails. But I put this here to say that, you know, we use the term burnout a lot just because there's a lot of research around it, and we have kind of the metrics to be able to measure it. But does it encompass the entire issue and the problem? We all know that there's a lot of overlap with other mental health concerns. So depression, anxiety, substance abuse. And when we're coming up with our kind of solutions and comprehensive plans as an organization, making sure that we're taking all of that into account. And then in addition, there's been growing call to kind of expand how we think about burnout, and the term moral injury is starting to gain a lot more popularity. And that's just kind of exploring the whole concept that every day in the work that we're doing, we're sometimes asked to do things that go against our values and what we believe is in the best interest of the patient. And, you know, going through that day in and out, that can obviously wear on you. And so, you know, one way that comes up pretty frequently in primary care is we now have these patient satisfaction scores, or you're worried about what your online reviews are going to look like. And maybe someone comes in asking for a medication that you know isn't indicated, and you're kind of going through this struggle of, do I do what I know to be right for the patient, or are you responding to these external pressures? And then obviously, as we saw with the pandemic in a wider sense, maybe being asked to share limited resources, or seeing patients dying alone without their family, and the impact and the trauma that comes from that. And so we're calling it burnout, but I'm sure, you know, there's going to be a lot of PTSD and other things coming out of it. And so just kind of having that in mind as we create our plans going forward. And then, so I specifically put in some data from pre-pandemic just to show that we're at a crisis level before entering into 2020. And as Dr. Calloway mentioned, you know, rates up to 54% affecting most physicians. And then interestingly enough, we're seeing a trend that younger clinicians were more affected. So those first 5 years out of residency tended to be a pretty critical period. And the thought is that, you know, you're being entered into this system that's already broken, and all the administrative burdens and the new EHR, and for people to think, can I do this for another 30 years? Like that's a challenge. And so it's concerning, because we're seeing a lot of professionals leaving the field. And then I had in here just kind of looking at some nursing data that we're not alone in this burnout. And again, this is pre-pandemic, and a particular survey, they saw that 63% of nurses were experiencing some form of burnout, as well as 90% in this particular survey had thought about leaving at some point. And then again, not to belabor the point, like why we should care about this, one, that our colleagues are suffering, we're suffering, and so what can we do to address it on that level? And then obviously, as we all care about our patients, kind of the impact as it relates to them. And as you know, part of burnout is sometimes depersonalization. And if you can't connect with your patients, they're bound to feel that on their end as well. And so I don't need to belabor the point, but yeah, just all the reasons why we need to come up with solutions pretty quickly. And so common causes, as we alluded to, a lot of it is around, administrative burden. So the time that you spend with patients is pretty limited. A lot of it is in, you have the computer in between you charting, and then you're going home answering messages and all of that. And so that whole connection and that healing practice, why a lot of us go into medicine, feels like it's being lost. And so that is kind of commonly cited as one of the big issues. And then, I put on this slide to say, in addition to all of that, just highlighting everything that was happening in 2020. So not only with COVID-19 are you worried about your own life, probably for the first time, but now the impact of your family and kind of the trauma that results from that. Then we had the wildfires at the same time. I know some people were impacted and having to evacuate at the same time that they were working in the hospital, as well as, around the time of the George Floyd protests and the issues around race relations and that kind of coming to a head, as well as like political tension with the election, financial struggles. We've seen a lot of data, and I think a lot of people can relate with, family life, having children at home and probably not having childcare, and now you're homeschooling in addition to work. So a lot of reasons, I think, for people to experience burnout. And the reason why I put this up there is, I think just to normalize the fact that we have all been through something traumatic as a profession, as a nation, as a world, and to expect to come out on the other side like completely unscathed is kind of unrealistic, right? And so starting from the point that we likely do need some kind of support and some help, and if that's a way to kind of open up the conversation to normalize it, then having the ability to do that. And, you know, we're still facing a lot kind of as a world currently. And then I promise I'm going to get to some positive things and some solutions. So hold on. I don't intend to make you feel worse. But I do put this up there to just have some context around, again, what we're dealing with and normalizing the challenges that we're facing. And so you see on here like the Maslow's hierarchy of needs, and the hope is that you're in the self-actualization triangle. And I think being in medicine, when everything goes well and you're connected to the joy in medicine, that's where we're functioning, right? You feel like it's a privilege to be with people when they're the most vulnerable. You can connect with them, be there, and see the impact that you're making real time. But I would say, you know, for the past 2 years, we've been at the bottom, right? Worried about your safety, just basic physiologic needs. And, you know, I remember there was a time, obviously with the pandemic, you couldn't connect with people, but at least you could go outside and enjoy nature. But then you have like the smoke-filled skies, right? And so feeling like there was kind of no relief from a lot of the stressors that we were facing. Okay, so I did want to open this up for our first breakout session. And please come back after this, because I promise we're moving on to the solutions. But just kind of talking amongst yourself, how is burnout showing up in your organization? And what have you observed? Have you noticed kind of differences across departments, specialties? And again, just kind of having the chance to connect with each other around how you've been impacted, whether personally or as an organization, and what that has meant. So we'll take about 5 minutes for that, and then come back as a group. And we're hoping that you can share some of your responses in the chat, some kind of highlights around what you've experienced. So, you know, Erin.
I will send them, yes, I will send everybody to their breakout rooms.
Okay, perfect.
And it should just be you and I in the main room now.
Okay. Okay.
Oops, no, we do have one
someone-
more. I think we've got one more person I need to unassign. Here we go.
Okay. And then Crystal was going to send it tomorrow, but I had created a handout just kind of reviewing some of the things that we'll be talking about at the end as it relates to like individual resources, and then sharing just some local wellness free like counseling and resources within California, and then also added the Santa Clara County crisis hotline information on there as well too.
Okay.
Yeah.
Great. Let me just see if I can, there's a person in the waiting room that I need to get into a breakout room.
Okay, sounds good.
Hold on a moment here. So Lori, if you can hear me, it looks like I'm not able to move you into a breakout room at the
I'm
moment.
so sorry. I'm driving.
Okay.
I didn't realize there were breakout sessions, and I think I was in one, and then I lost reception, and then
Gotcha.
so
No
I
worries.
apologize.
That's okay. You can just hang out here.
Okay, thank you.
Sure.
Okay. All right.
So I put her back in the waiting room, so she's just there by herself.
Okay, sounds good.
And I did, I put a 5-minute timer on there, so it'll automatically count down the last 30 seconds, and then they'll all come back.
Perfect. I'm just looking at. Okay. Yeah, so I think I could just read some of the comments from the chat many people.
Oh, yeah. Do you know Dr. Joytia Rao?
I don't know them personally.
Okay, she's with Kaiser San Jose, and she's been really involved in physician wellness.
Okay. Yeah, I don't
And
know,
she's on.
but I feel like I've seen things from her on the online space.
Oh, yeah. Okay.
But I haven't met her personally.
Yep. I just realized I forgot to pause the recording.
Oh,
I don't even know how to do that. Oh, there we go. Pause.
all right. I think that's everyone. So welcome back, everyone. I hope you had the opportunity to connect with each other about. Okay. Yeah, so welcome back. And I hope you have had the opportunity to connect with each other about how you've been impacted at your institution. And if you could just enter in the chat any key topics that came out, I'd love to read it out loud so we can share with everyone. A couple minutes. And then we'll be kind of jumping into the solutions part of things. So staffing issues is definitely a major concern. Physicians requesting to go part-time due to burnout. Everyone has a short fuse. Wellness activities are offered, but it competes with time to complete records. Not having resources to do what we want and know what's best to take care of our patients. Colleagues retiring earlier. So yeah, so we definitely see a theme, right, of people leaving, wanting to cut back their time, and then how that impacts those who are left behind, and just kind of making that cycle a bit worse. Okay, so at this point, thank you everyone for entering your comments. I'm gonna move ahead to the solutions portion just so that we can make sure we have time for our check-in breakout, so you can talk about kind of where to go from here and what can we do. And I like to call this part, there is hope. So we'll be moving on to some of the things that we can really do to make an impact, both within your organization and then on a broader scale. So this was a framework that I had created at Recharge MD, just looking at how can organizations come up with a comprehensive systems-based approach to burnout. And if you look, we'll just be going through the different buckets, but basically in the middle, you have kind of yourself and your people. And then on the outside, you have kind of the different factors that are impacting their experience of being at work and being in your organization. So starting with practice of medicine, that's just looking at your practice efficiency. Do you have a functional EHR? Are there basic things that are placing unnecessary barriers to being able to provide care? Looking at the organization piece, it's really talking about kind of the culture of the workplace. Is there a real emphasis on wellness? Are there resources behind it? Is there a budget? Do you have a chief wellness officer or someone who, it's within their purview to be measuring what's happening and tracking the progress that's being made? And then lastly, just how we're functioning within our broader healthcare system, like what's happening at the policy level, and can we have a say, or can we advocate at that level to be able to address burnout? And I'll be talking about it later. I think there are some exciting things in the pipeline, but just kind of remembering that we can have an impact outside of our organization, and being part of groups like this really gives you the ability to collaborate and your strength in numbers, and being able to make an impact kind of on a broader scale. And then I will say kind of for the self and people, depending on what's going on the outside, right? You're constricting your people in the middle. And depending on who you are, you're going to have a different experience of working in an institution, right? So women and people of color, underrepresented minorities may have different stressors that they're facing, and making sure that whatever plan that you're coming up with, that it intersects with your DEI work and quality and safety, and just realizing that that this intersects with a lot of other parts of wellness. So just to parse it out a little bit more and what organizations can do in these various areas. So looking at the organization piece, like what can you do around culture change? Do you have internal wellness initiatives? And do you have someone who is there to kind of answer to what the initiative will be for the organization? So I think one of the exciting things is that there's been this move to creating the position of the chief wellness officer, and really giving them the budget and the authority to be able to make some of these changes. So in some organizations that have been successful, you know, the chief wellness officer is in the C-suite and they answer to the CEO and have kind of a direct line and have a seat at the table as it relates to kind of the bigger initiatives for the hospitals. And so how do we get closer to that for more organizations, as well as having really the funding and the administrative support behind it? Because I think it's almost worse if you do the surveys, but you're not really intended to act on it, right? And so how do we make sure that we actually have the ability to put some of these changes in place? And then next, looking at the practice of medicine bucket, and that's really looking at your operations and your efficiency. In some programs, they've worked and partnered with the COO to see, okay, what can we do in terms of, you know, throughput in the emergency department? Is there something that we can improve there to improve the experience for those working in that area? As well as how can we improve our EHR? Like how many clicks does it take to order something? And can we put some pressure on some of these EHR companies to improve interoperability and the ability to communicate with different systems, as well as some have instituted some kind of flexibility around scheduling and what that looks like. And then the next is just kind of looking at our broader healthcare system. As we know, you know, there's been the corporatization of medicine. You see a lot of these big mergers and conglomerates. And I think, you know, in the past, physicians had the ability to work in private practice or maybe have some more autonomy about the ways in which they practice. And that is kind of, that option is kind of diminishing, right? As if you're going up against these larger giants and systems. So how do we create programs within these organizations to be able to restore some of that autonomy? And then I'm a big proponent of how do we get more physicians into leadership and leadership training and development. I think, you know, that's lacking a lot of times in medical education. There's really that focus on the clinical piece, which obviously is important, but how do we get more physicians to be a part of kind of some of these other changes? And so I think one of the wonderful things is that we're seeing more of that in medical education. So residency programs, seeing more fellowships cropping up around leadership development for physicians. And I think that's going to have to be part of the approach as well as policy change. So I think for the first time, we have a lot of national attention around burnout. And there was recently an act passed around Dr. Lorna Breen Act in order to increase resources towards wellness. And I think there's a move towards expecting organizations to have a plan and a program in place, as well as there's been talk of potentially, you know, changing some of the rules around payers and what is required in terms of like documentation to make that burden a little bit easier, as well as more grants and funding becoming available from the government to be able to address some of these issues. So I think, you know, there are a lot of different levels to approach things, but I think making sure that you're intentional about where you want to start and making sure that you know, you're not missing some of these other pieces, as well as definitely the important part, like how do you support individuals while we are trying to make some of these bigger systems and policy changes? That takes time, right? And people need support today. So what do we have in terms of mental health resources? Can you reduce the barrier to accessing that care? I think there's, like I said, there's still a lot of stigma in medicine, and a lot of people are concerned about their medical license. If they access, you know, their EAP program, is that going to come up on their recertification paperwork? And so what can you do to reduce those barriers? I know there are some programs that have started like an opt-out approach. So for medical students, everyone is given access to a certain number of therapy sessions and you have to opt out. So how can you be creative about kind of normalizing the need to get that support, as well as a growing push for more peer support spaces and in the form of coaching as well, and how can we create more safe spaces to debrief about the experiences that we've had. So just wanting to have the opportunity for you all to talk again. This would be our second breakout session, and just want to know, like, where are you for your organization in your wellness journey? Are you just starting out? Are you further along? And what has that process looked like for you? As well as based on the things that we've talked about, like, where do you think you can make the most impact? Where can you start? And what could that look like potentially for your institution? So we'll be breaking up into groups one more time for 5 minutes, and then we'll come back and debrief about that.
We had a couple stragglers, so I put them in the waiting room for now.
Okay, that sounds good.
And I forgot them.
All right, welcome back, everyone. So I hope you all had engaging discussion amongst yourselves, and we have time for a couple comments. I think instead of the chat, maybe have two people, you know, share a highlight that they had from their conversation. You want to come off mute? Or you can stick with the chat, whatever people feel comfortable with. Okay, so I have one comment here saying missing out on in-person activities during the pandemic, and now being able to resume. I think that's definitely something that one could institute pretty quickly and have an impact early on with.
I'd like to just say from our group, we had comments that there oftentimes people feel like doctors need to be more resilient, but the comment was that the workload is just unsustainable in a lot of departments because of lack of staffing. So systemic issue.
And so how do you address those first and get to the root cause? Thank you for sharing that. And I see a comment here. We need a fundamental change in medicine, more flexibility in terms of schedules, time for self-care, ways to find support without judgment within your practice. Absolutely. Then we have time for one more comment.
Fayola, I had someone in my group talk about the interest and enthusiasm around wellness, and led sometimes by the leader of the department, but not knowing kind of the how-to and how to harness that energy in a way that benefits the team.
Okay. And that makes sense. And I think the interesting thing about that is, you know, the field is in flux and a lot of this is new. So I think that's a challenge, but also the exciting part, and that you're coming in from the ground floor. And again, having groups like this where you're able to connect and share like what's working for you, what's not. I think that's kind of the level where we are. And hopefully as some of those things solidify and we find best practices, it will make it easier to scale and roll it out. But I think at this point, it's still in that experimental phase. And then the solutions are going to be different, right? Based on where you're working. Like the challenges for surgery are not going to be the same for primary care. And so how do you have, you know, wellness leaders within each department that can speak to the problems that you may be addressing or facing at the local level, as well as listening to the people who are closest to the problem, right? They likely have a lot of great suggestions. And how do we have these conversations so that we likely don't have to reinvent the wheel, but what are some basic changes that could be made that can be really impactful early on. So yeah, definitely a lot of good points that you've all made. So at this point, I wanted to transition a little bit to talk about what we can do to support ourselves as individuals as we're kind of continuing this work, because you know, systems-based change, I think, is going to be a big part of how we address burnout and how we encourage wellness. But those things take time, especially within healthcare. Things can move very slowly, and especially if we're talking on the policy level as well. So what can we do to provide support for ourselves, as well as give ourselves permission to take care of ourselves and practice self-care? So I'm going to be mindful of the time. I may skip some of these slides, but just looking at, as we alluded to at the beginning, this concept of what you feel is okay, and radical self-acceptance and some compassion around the things that we may be experiencing, and normalizing that we're going through a hard period. And I think with, you know, now that things seem to be slowing down and we're opening things back up, there may be that rush to say, okay, everything's okay now, we can go back to normal, and making sure that we hold on to the fact that no, we've been through a lot, and how do we leave that space to be able to heal and kind of grieve from that, as well as going over some things around self-care. And I do have some resources that I will give to Erin after this talk that she could share with you all about, just free resources that are available within the state and specifically within Santa Clara County, that we can all access if you need. So I'm going to skip this in the interest of time. It was something I had written. I'm not a writer, and I usually love to play music, and I'm in a community orchestra. And when that shut down, I tried to experiment with poetry. So I can send that to Erin at a later date. Okay, so I'm going to skip to this so that, again, we have some time to talk, and just looking at self-care. And you know, I know sometimes it can feel like trite when you go to wellness talks and it comes down to self-care, but I think it's actually a really hard and challenging thing to put into place as physicians and medical professionals, because, you know, in training, basically you're taught not to practice self-care, and it's actually a bad thing to put yourself first, and we're kind of rewarded for not eating, not sleeping, and just working really hard and always putting our patient first. And so how do we start to unlearn some of those things and give ourselves permission to create some rituals around caring for ourselves? And so one thing is part of the handout that I was giving to Erin, but if you wanted to write down just even in one thing that you think would be helpful for you, it may be something really basic. Again, sometimes we can create these big charts around what we should be doing, and then you feel worse because you haven't been able to institute it. So like, what's one basic thing that you think that you could do for yourself that would be helpful? One example that I give is I was part of a mom's group after I had our third daughter, and our kids are very close in age. So they're 5, 4, and 2. And at the time it was just a really, really challenging. And so they had us go through this exercise. And on my list, I think it was like shower every 3 days and keep everyone alive. And so it was very simple, but it worked, right? And it really is just kind of that practice of giving yourself permission to take care of yourself and put yourself first. And again, it can seem trite, and it's something that I think as a community we don't value at all, and it's kind of looked down on. And how do we start to unlearn some of that? So I want you all to write just kind of one thing that you're looking forward to being able to do for yourself. And if you feel free to, if you want to share, putting that into the chat, and then we'll leave some time for questions. Okay, Stanford women's basketball hosting NCAA tournament. You see, I'm not a sports person, but I'm glad you're excited for that. Taking a vacation and not worrying, that's big, right? And hopefully you don't have to check any messages and you have someone covering your in basket while you're away, so you can completely unplug. We'll take one more and then we can open it up for questions. Looking forward to Sonoma Film Festival. Wonderful. Getting together with friends for the first time. These are big, right? Being able to reconnect with family, I think things that we've really been missing out on. So thank you everyone for your time today and for participating and engaging and being involved. I really appreciate that. And at this point, want to open it up for questions before we have kind of a closing mindfulness exercise with Dr. Wright again.
Fayola, can you tell folks how they can get in touch with you? What's the best way?
I will put that up on the screen.
Perfect.
And so this is my email address. Feel free to reach out via email. I'm also on LinkedIn. So I try to post things weekly about new updates in burnout or wellness. I've really taken an interest in kind of the policy level change. And so as things happen in that space, or if new grant funding is available, I'll typically try to post about that, as well as have created like a newsletter with updates around those changes. So feel free to reach out if you would like access to any of those resources.
And you have a great presence on LinkedIn, by the way, and share some really helpful resources. So thank you if anybody wants to connect on LinkedIn.
Thank you for that. And then this is also part of the handout that I'm giving to Erin to distribute after. These are all free resources that are available. I'll point out one that I think is exceptional is the physician support line. So it's staffed by all volunteer psychiatrists. You know, it's completely confidential. A lot of people worry about accessing care because they don't want to have records or anything like that. And so they, you know, as we said, it's completely confidential and they want to respect everyone's privacy as it relates to that. And I believe they are staffed until like 2 a.m. So they can also help kind of link you with local resources, but it's a great step just to get in touch with somebody. As well as a local one in California is a frontline workers free counseling. That one I believe is staffed by licensed clinical social workers and psychologists. It's also all free. And that's open for everyone kind of in a forward-facing role. So I believe they work with firefighters, basically anyone who's having concerns. And again, that's free as well. And then we have up there the Santa Clara County Crisis Helpline, and everything's up to date. So these are all great resources to have. So if there aren't any questions, I can jump to ones that were submitted before the talk. Or again, if anyone wants to go off mute, I'd be happy to answer some.
I can speak sort of on behalf of our breakout group with a question, and it's one that's been hard for me to understand for a long time, Fayola. It's a big paradox because what comes up a lot in these conversations is that the suffering physicians feel is the inability to actually do justice to the work that they're trying to do, that their own call to service is to do right by their patients. The paradox to me is what CEO or CMO or governor of a state, for that matter, wouldn't want their doctors to do exactly that. And so why does this end up as a paradox. You know, I think you've tried to address, trying to look at these things at very high policy levels and payer levels and things beyond individual institutions, because clearly this crosses way before that. I mean, crosses all of that. So I'm curious from your look at this, and as such, then how we reframe the conversation to make that regain alignment on that.
Yeah, no, I've definitely looked at this as well too. I think a lot of it traces back to kind of misaligned incentives in terms of like payer systems. And so you see, what I hear a lot about is just kind of decreasing reimbursement rates within hospitals. And so the response for that is just kind of see more patients. And so, yeah, it's a big issue. I've tried to do more in terms of just kind of connecting with healthcare executives to see kind of how they're seeing the issue. And I think for them, a lot of it is just concerned, can they keep the hospital open with these reduced reimbursement rates? And so a lot of it has been kind of focused at that level. And so, you know, for me, I think a big part of the advocacy is like, how do we get more physicians in at that level? How do we get them kind of at the table, at the policy level, to be able to make some of these changes? And I think the hard part is, right, if you're working full time, you're just, you know, you're drowning. You don't have time to think about any of these things outside of that. And so I think, how do we create a physician leadership workforce that can be a part of this? And I think, you know, medical associations can be a part of this, and certain professional societies, because you have the numbers there, right? It's a lot easier than trying to fight this on your own. But yeah, I think that's a big part of it. It's just kind of the payer structure, and how do we address that? And I don't feel like I have the great answer for that, but I think if we're able to crack that issue, that could really improve things.
As you're responding, that makes me think that would be an excellent topic for one of our further ones in this series, because I agree with the other people that said, I mean, I do personal wellness things, but like you, that's because I already been trying to change the system for 30 years and nobody's made me queen yet, like everybody else on this call, right? So we do have to, I don't want to wait another 10 years, 20 years, 30 years to be happy, you know? So nor does anybody on this thing, but it does really, beg that level change, I think.
Yeah, and I think now is actually an exciting time in the sense that you have that national attention that wasn't there before. And I think there will be a lot more pressure on organizations to have something in place versus, you know, relying on someone's goodwill to think that wellness is important. I think, you know, at some level, it's going to be taken out of individual institutions' hands and be kind of required that there's something in place to address it. So, you know, I'm hopeful from that aspect of things that we'll actually be able to make real changes. And we're seeing that happen kind of for the first time on a national level. And it's just, you know, how do we get more people to be part of that conversation? So I think we are at time. Thank you again, everyone, for this opportunity. It's really been a pleasure. And like I said, please feel free to reach out after if any questions. Happy to get in touch with you. And thank you again.
Thank you so much, Dr. Fayola Edwards-Ojeba. This was a brilliant talk, just from so many levels: practical, systems change, solutions. Just getting us to think deeply into these questions is so important. I wanted to just offer the stage to Gail, who's going to take us through our wellness bite tonight.
Well, on the personal recharge level, I was taking Dr. Edwards-Ojeba's organization's title, the name, and thinking about that. And I agree with what she just said, just little, I offer these as little bites, because like a little snack, like something we can actually do this week. Because we all know in trying to do motivational coaching ourselves that if you don't make the change this week, it ain't happening, right? So just pausing for a second while we're still on here and say, what actually is your energy source? What charges your batteries? We talk a lot about what sucks it out of us, but usually the key in this across a sustainable career is keep in the good inbox, not the hateful inbox, but you know, what keeps your energy up. And that can come from, you know, she just was talking about playing music. You know, some of these kids are in the background, which is mixed bag, but usually enriches us, net gain, social connectivity like this. So just thinking about these things. And I have a matrix, if anyone wants it, that was like Fayola's, that has these ones spread across. And then you can just pick, and just for, you know, 2 minutes a day, literally 2 minutes. Like the little breathing exercise we did at the beginning was 90 seconds, just to put it in perspective. You know, it takes longer than that for my Epic to log in the morning. So even if you take it while your Epic is logging in the morning, you know, to try to do something that's a little renew and recharge, and think about spring and what's coming alive, what might want to be coming alive for you.
Thank you for that reminder, Gail. I will, every morning at my Epic opens, it's 90 seconds where I could just build my own sense of wellness, and a great start to the day. That is brilliant.
Actually, if you make your login something that makes you happy too, think how many times we log in to the EHR every day. That one is a little booster too.
Thank you. I just wanted to close with reminding everyone about several things coming up, very exciting over this month and next month. As I mentioned, the Renewal Retreat is just 2 weeks away. So please go to our website and fill out that survey, and you could potentially be part of it. In April, we have the reflection rounds with Gail Wright. It's a safe space to gather as colleagues and reflect and explore how encounters in medicine affect us personally, really intimate and profound. So I highly encourage that as well. In April, we have a couple things going on as well. On the 21st and 28th, from 9 to 12, these are Saturdays, I believe, Restoring Joy to the Practice of Medicine Together. This is a conference put on by the Bay Area Clinician Wellness Collaborative. And then finally, our next and fifth Resilient MD series speaker will be Dr. John Chuck on April 26th. And he's a great speaker, and I know that you guys will enjoy that. So thanks everyone for joining. And those are some websites. Dr. Fayola Edwards-Ojeba also shared her contact, so reach out to her. We're super excited to connect everyone together, and we'll see you next month.
Thank you, everyone.
Have a wonderful evening unless you have other plans.
Thanks, everybody. Really appreciate it.
Everyone.
Nice job.
Thank you.
Thank you.